I'm Dr. Foss. I'd like to show you a little bit of information about my office, how I treat pregnant women in my office. I use a technique called the Webster Technique, and basically the Webster Technique is a very, very gentle technique where we go in and really work with the spine, we work with the pelvis, we work with the back to help kind of change the positioning and the shape of the uterus. And so many times for women, especially during their second and third trimester, can have the baby move very, very far down into the pelvis, sometimes into that breech presentation where the baby's pushing a lot onto the hips, pushing a lot into the tailbone here. And so with the technique, what we do is we go into the round ligament. The round ligament is basically what supports the uterus and keeps the uterus in place. Many times there's a tightness on one side of that ligament versus the other side, and so as we go in, we're positioning our fingers, we're just putting a slight pressure, it's not dangerous for the baby at all, slight pressure into that ligament to help that ligament loosen up, and at the same time we're lining back up the hip alignment and the low back alignment, which is really essential to keep that uterus open into a space large enough so that the baby can move back into the position. So actually we can help not only adjust the mother's spine, but also help the baby adjust itself in the uterus. So I'm going to do a small just demonstration of that today. Alright, so this is Rochelle, and she's in her third trimester already. I'm going to have you lie on your back. And so it's all really about comfort, making sure patient's comfortable with the technique, and you're going into an area just a little bit sensitive for them. And so what I usually do first is check the lengthening, and you can see she's a little bit shorter on her left side today than on the right side. So we go in and just feel right on the side of the hips right here. Interesting. So it changed over a little bit, so a little more tightness on the right side than the left side. So what we do is go right into the round ligament right there. She should feel, you can feel that. You doing okay? All right. Good. Okay. Right there. And hips back down. And you can feel that area start to loosen up. Great. I'll have you lie on your side over this way toward me. Good. There you go. Good. Take a deep breath in. Bring your arm down a little bit. There you go. And then deep breath out. Good. Good. There you go. On the other side, just like that. Deep breath in again, and then deep breath out. Good. On your back. Alright, so then I recheck the leg. You can see right away that her left leg's come back to an even position. So what that's done is really help line back up that low back and hip area. Good. Just recheck the area. And you can feel how that's loosened up already. That's good. Alright. If you have any questions about the technique or any questions, feel free to check out my website. I'll have a link below. It's portavitasanantonio.com. Feel free to call me with any questions or concerns, or if you know somebody that's suffering from back problems due to pregnancy, feel free to check out my office. Thanks so much.